Assalamualaikum dear students, it's Dr. Masma Mehtab. Welcome to my YouTube channel Medical School. So today we are going to learn about the granulomatous diseases of nose which are caused by fungi. So let's start. Now these granulomatous disease these are the three types of granulomatous diseases which are caused by three other types of fungi. So here we have rhinosporidiosis and then aspergillosis and mucormycosis. So starting with the rhinosporidiosis, this is the disease which is caused by fungus. So it's a fungal infection caused by rhinosporidium seeberi. And most common cases you will see in Pakistan, India, and Sri Lanka. Now, the causative agent has three stages of its life cycle. So, starting with the trophic stage, and then the sporangium and the production of endospores. So here is the life cycle. Here you can see the endospore is basically a spore which contains nucleus in the center, nucleolus, a clear cytoplasm, and a chitinous wall. So it divides to form the trophozoite. Remember, the cell wall is actually not dividing, only the cytoplasm is dividing, and then the trophozoite is formed. Then we have intermediate sporangium, and when these endospores, which are actually developing within the trophozoite, they get mature, then we have the sporangium. Now, this sporangium, within that, what happens is increased intracellular pressure. When there's intracellular pressure is increased, these endospores will liberate, and these endospores are now free to release. So, the clinical features mostly it affects the nose and the nasopharynx, but other sites can also be affected like lip, palate, conjunctiva, epiglottis, and larynx. In nose, there's leafy polypoidal mass, pink to purple in color. So there will be a polyp-like mass that will be pink or purple in color, and it is attached to the nasal septum or lateral wall of the nose. Now it's really high vascular. Now what happens whenever you touch this mass? What will happen? This mass will bleed easily because of its highly vascularized. Now here is a clinical presentation. You can see here the pink or purple color mass which is actually attached with the nasal septa or to the lateral wall of the nose. As I have told you that it can also affect other parts of the body like conjunctiva lip palate. So I have shown here an example of the conjunctiva. So this is the conjunctival rhinosporidiosis. So diagnosis after the clinical examination, you have to go for the biopsy and that will reveal the presence of sporangia and endospores within the mass. So the treatment is surgical and then you have to go for the medical treatment. So the surgical treatment involves a diathermy that will remove the mass, but the base of the mass is removed by the cauterization. So this is the surgical type, and then we have the medical treatment. You have to go for the dapsone. Okay. Second condition is aspergillosis, which is caused by Aspergillus niger. So it occurs in patients having compromised immunity or taking immunosuppressive agents. So this basically occurs in weak immunity patients. Okay. Now, clinical features, it can be acute, it can be subacute rhinitis or sinusitis. You will see acute or subacute rhinitis. Rhinitis, we know it's the inflammation of the nasal mucosa, and sinusitis, we know it's inflammation of the sinus. And acute, that means less than 3 months, and subacute, that is up to 3 months. So, acute or subacute rhinitis or sinusitis, you will see black or grayish membrane in the nasal mucosa, and exploration of maxillary sinus reveals the fungal ball. Now you cannot see the maxillary sinus by your own eyes, but you have to go for the X-rays for the exploration. Okay, now this is the invasive type of aspergillosis. Initially, it was in the nasal cavity, but it invade the hard palate. As we know, the floor of the nasal cavity is made up of hard and the soft palate. So soft palate was here, and there is a hard palate. So it invade the hard palate, and here you can see the mass. That is aspergillus. Now the treatment again, you have to go for the surgical removal of the fungal debris and involve necrotic tissues. You have to remove these tissues, and then you must go for the medical treatment. It includes amphotericin B. Now this is the antifungal drug that is necessary. It will actually prevent the recurrence of the disease. And the third condition is mucormycosis. So it's basically fungal infection of nose and sinuses and occurs in the patient having high diabetes and if they are taking immunosuppressive drugs. So the clinical features include black necrotic mass, which is seen in the nasal cavity, and the infection can easily spread from nose and sinuses to orbit, meninges, and brain. So it was actually infection of nasal cavity, but it can easily spread to orbit, meninges, and brain. Now, this fungus affects the arteries and causes thrombosis, and that is the reason behind its spreading and rapid destruction. So, here you can see this is the black necrotic mass, and it can easily spread to the sinuses, orbits, and then meninges. So, the treatment again, we have the same treatment. You have to remove the necrotic mass, that is, black necrotic mass must have to be removed by means of surgical processes and go for the amphotericin B, which is an antifungal treatment. Okay, I think I'm clear up to this. If you have any query or question, you can ask in the comment section. Thank you.